Hello friends, so today we'll be having some MCQs regarding basic hematology and laboratory procedures, and I will also be telling you the answers with explanation so that you guys will have good concept of the answers. So kindly, if you guys are new, subscribe my channel. I need some support, so I would keep posting material and technical videos for you guys to learn. Okay, the first question is insufficient centrifugation will result in a false increase in hematocrit value, a false decrease in HCT value, no effect on HCT value. All of these options depending on the patient. So the first answer is A, false increase of hematocrit value. Insufficient centrifugation does not pack down the red blood cells, therefore the HCT, which is the volume of packed cells, will increase. Second question, variation red cell size observed on the peripheral smear is described as anisocytosis, hypochromia, poikilocytosis, pleocytosis. So the answer is anisocytosis. A mature erythrocyte is approximately 7 to 8 micrometer in diameter. Variation normal size is denoted by the term anisocytosis. Variation normal size is denoted by the term anisocytosis. Hypochromia is a term that indicates increased central pallor in erythrocytes, and poikilocytes denotes variation red cell shape. Okay, so the third question, which of the following is the preferable site for bone marrow aspiration biopsy in adult? So the with the options are iliac crest, sternum, tibia, spinous process of vertebra. So the answer is iliac crest. The iliac crest is the most frequently used site for bone marrow aspiration and biopsy. This site is the safest and the most easily accessible for the bone just beneath the skin. Neither blood vessels nor nerves are in the vicinity. So getting a bone marrow sample is much more easier, so you don't have to mess up with the nerves and other things. Fourth question, mean cell volume is calculated using the formula hemoglobin divided by RBC into 10. Hematocrit value divided by RBC into 10, HCT divided by hemoglobin into 100, hemoglobin divided by RBC into 100. So the answer is B. The formula for determining the MCV is HCT divided by RBC into 10. MCV is the volume of the red cells. This is obtained by dividing HCT packed cell volume PCV by the red blood cells. So the formula for finding MCV is HCT divided by RBC into 10. What term describes the change in shape of erythrocytes on a right stained peripheral blood smear? Poikilocytosis, anisocytosis, hypochromia, polychromasia. So the answer is poikilocytosis. The term that describes the change in shape of a erythrocyte seen on right stained peripheral blood smear. So this process is called poikilocytosis. A variation in shape of erythrocytes on a peripheral blood smear is poikilocytosis. Anisocytosis refers to a change in size. The acetocytosis determines the change in size. Hyperchromia is increased in pallor in erythrocytes. Polychromasia describes the bluish tinge of the immature erythrocytes circulating in the peripheral blood. So the change in shape of erythrocytes seen using red stained peripheral blood smear is change in shape is polygocytosis, change in size is anisocytosis, and hypochromia is somewhat related to central polar, and polychromasia describes the bluish tinge of the immature erythrocytes circulating in the peripheral blood. So erythrocytes determines the shape, anisocytosis determines the size, and hypochromia is increased in polar erythrocytes. Calculate the mean cell hemoglobin concentration MCHC using the following values. Answer is C. So how did you find the answer? MCHC is the average concentration in hemoglobin in red cells expressed as percentage. It expresses the ratio of weight in hemoglobin to the volume of erythrocytes and is calculated by dividing hemoglobin by the ICT and then multiplying by 100. So how do we find the MCHC? MCHC, the formula is that first calculated by dividing hemoglobin by ICT and multiplying by divide by 100. We divide hemoglobin divide by ICT and then we multiply it by 100. That is the formula for MCHC. The formula for finding the MCHC is ICT divided by the hemoglobin into 100. Hemoglobin by the ICT into 100. A manual white blood cell count was performed. A total of 36 cells were counted in all 9 mm squares of a Neubauer ruled hemacytometer. A 1 to 10 dilution was used. What is the WBC count? So the answer is A. And how did we determine the answer? The formula used for calculating manual cell counts using hematocytometer, number of cells counted into dilution factor into depth factor divided by the area. Number of cells counted by the multiplied by the depth factor, that is 10, multiply and then dividing, here it is, depth factor divided by the area, dilution factor into depth factor into number of cells counted divided by the area. So for finding the what you call the WBC count using a cytometer, a metacytometer, the formula is that number of cells counted into depth factor into dilution factor divided by the area, and the answer was for 7th was A. When an erythrocyte containing iron granules is stained with Russian blue, the cell is called siderocyte. Siderocytes are red cells containing iron granules and are visible when stained with Prussian blue. So siderocytes are they have iron granules and they can be visible using when stained with Prussian blue. The 9th question: a 7 ml ETDA tube is received in the laboratory containing only 2 ml of blood. If the laboratory is using manual techniques, which of the following tests will mostly likely be erroneous? The answer is C, HCT, and here is the explanation. Excessive anticoagulant causes shrinkage of cells, thus HCT will be affected by RBC and WBC counts remain the same as does the hemoglobin content. Excessive anticoagulant causes shrinkage of cells, thus HCT will be affected. RBC and WBC counts will remain the same. So RBC and WBC counts will remain the same. The only thing which will be affected by is HCT. Because a 7 ml of ETDA tube is received in the laboratory containing only 2 ml of blood, but if the laboratory is using manual techniques, the thing which will be erroneous is HCT, because WBC and RBC will not be affected by it. A 1 to 200 solution of a patient's sample was made and 336 red cells were counted in an area of 0.2 millimeter cube. What is the RBC count? So the answer is D, 6.66 into 10 raised to 12 per liter. How did we find the answer? Neutrophils are highly phagocytic and release lysozyme, peroxidase and pyrogenic proteins. These neutrophils migrate to sites where there is an allergic reaction or parasitic infestation, releasing peroxidase, pyrogens, other enzymes including an oxidase that neutralizes histamine. They are poorly phagocytic and do not release lysozymes. What phagocytic cells produce lysozymes that are bactericidal? So the answer is D. Why? Because these cells are highly phagocytic. They engulf everything which is foreign particle. And for the 10th, the answer was B, and that is 3.36 into 10 to 12 per liter. How? RBC count is determined by number of cells counted into dilution factor into death factor divided by the area. RBC count is number of cells counted into death factor and dilution factor divided by number of area. If a patient has a reticulocyte count of 7% and an HCT of 20%, what is the corrected reticulocyte count? So the answer is B, 3.1%. In an anemia state, the reticulocyte percentage is not a true measure of reticulocyte production. The following formula must be applied to calculate the corrected for anemia reticulocyte count. Corrected reticulocyte count, reticulocytes percentage into HCT divided by 45. The average normal HCT in this case is 7 into 20 divided by 45. So the formula is for reticular count is reticulocytes percentage into HCT divided by 45. A decreased osmotic fragility test would be associated with which of the following conditions? Acquired hemolytic anemia, hemolytic disease of the newborn, hereditary spherocytosis, sickle cell anemia. So the 13th answer is sickle cell anemia. Osmotic fragility test would be associated with sickle cell anemia. Osmotic fragility test is decreased when numerous sickle cells and target cells present and is increased in the presence of spirochetes. Spirochetes are a prominent feature of the hereditary spherocytosis, hemolytic disease of the newborn and acquired by hemolytic anemia. The osmotic fragility test is increased in presence of spirochetes, whereas the test is decreased when sickle cells, target cells and other leukocytes are present. So osmotic fragility test is related to sickle cell anemia. What effect would using a buffer at pH 6.0 have on a right stain smear? Red blood cells would be stained to pink. What effect would using a buffer at pH 6 have on right stain smear? Answer is A, red cells would be stained to pink. The explanation: the pH of a buffer is critical in Romanowski's stains. When the pH is too low, less than 6.5, 6.4, the red cells take up more acid diocin, becoming too pink. So when the pH is less than 6.4 and the pH over there was 6, so the cells will absorb more acidic eosin that will result in too much pinkish cells. Which of the following erythrocytes inclusions can be visualized with supervital stain but cannot be detected on right stain blood smear? Answer is B. Heinz bodies. Heinz bodies are irregular, refractile purple inclusions that are not visible with right stain but show up with supervital staining. The other three inclusions can be detected with right stain. So the Heinz bodies are visualized with supervital stain but cannot be detected on right stain blood smear. A falsely elevated ICT is obtained. Which of the following calculated values will not be affected? MCH. The MCH is equal to hemoglobin into 10 divided by RBC count and is not affected by the ICT. The MCV is equal to ICT into 10 divided by RBC count, and the MCHC is found out by hemoglobin into 100 divided by the ICT. MCV is calculated by ICT into 10 divided by RBC, and MCHC is calculated by hemoglobin into 100 divided by the ICT. Therefore, an erroneous ICT will affect the parameter. Centrifugal force for microhematocrit determination should be 12,000 grams for 15 minutes. In order to avoid error caused by trapped plasma, the red cell distribution with RDW is calculated by the electronic cell counters and reflects the variance in the size of the red cell population. Electronic cell counters calculate ICT from the MCV and the RBC count. Therefore, the RDW would be affected by an erroneous MCV. A Miller disc is an ocular device used to facilitate counting of reticulocytes. Miller disc is an ocular device used to calculate, facilitate, or counting of reticulocytes. The main reticulocyte counting involves a counting of 1000 RBC. The Miller disc is a reticle grid that is placed in the eyepiece of the microscope and divides the field into two squares, one being 9 times larger in size than the other. Reticulocytes are enumerated in both the squares. Mature red cells are counted in the smaller one. Situation: RBC indices obtained on an anemic patients are as follows: MCV 88 micrometer cube, MCH 30 pg, MCHC 34%. The RBCs on the peripheral smear would appear seen normocytic and normochromic. The MCV, MCH, MCHC are all within the reference internal volume range. Hence, the erythrocyte should be of normal size and should reflect normal concentrations of hemoglobin. Therefore, the anemia is normocytic, normochromic. All of the factors may influence the ESR except blood drawn into a sodium citrate tube. EDTA and sodium citrate can be used without any effects on the ESR. Anisocytosis and polycytosis may impede Rillex formation, thus causing a low ESR. Plasma proteins, especially fibrinogen and immunoglobulins, and hence relax, decreasing the ESR reference regions must be established for different caliber tubes. What staining method is used most frequently to stain and manually count reticulocytes? 20B. Supervital staining. The reticulum within reticulocyte consists of the ribonucleic acid R, which cannot be stained with right stain. Staining with new methylene blue is used to identify the reticulocytes. The Coulter principle for counting cells is based upon the fact that the answer is isotonic solutions conduct electricity better than the other cells do. The Coulter principle for counting of cells is based on the fact that isotonic solutions conduct electricity better than the other cells do. The rest of the options are not correct. A correction is necessary for WBC counts when nucleated RBCs are seen on the peripheral smear. So here are the answers. So the answer is the RBC count is too low. A correction is necessary for WBC counts when nucleated RBCs are seen on the peripheral smear because the RBC count is too low. And using electronic cell count analyzer and increase RDW should correlate with B, anisocytosis, because it determines the size. Spherocytosis determines the shape. Given the following values, which set of red blood cells in interstices suggests spherocytosis? The answer is C. Spherocytosis has a decreased cell diameter and volume, which results in loss of central polar and discoid shape. The index most affected is the MCHC, usually being in excess of 36%. Which of the following statistical terms reflects the best index of precision when comparing two CBC parameters? The answer is coefficient of variation, because coefficient of variation statistical terms reflects the best index of precision when comparing complete blood count parameters. Coefficient of variation is the answer. So which of the following is considered a normal hemoglobin? Deoxyhemoglobin. The answer is deoxyhemoglobin, because there are two types of hemoglobin, oxygenated and deoxygenated. And deoxyhemoglobin is considered normal. Which condition will shift the oxyhemoglobin dissociation curve to the right? Acidosis. A. The answer is acidosis, because alkalosis shifts the curves to the left, and multiple blood transfusion also shifts the curve to the left. What is the major type of leukocyte seen in the peripheral smear of a patient with aplastic anemia? The answer is B, lymphocyte. Lymphocyte is a major type of leukocyte seen in the peripheral smear of a patient with aplastic anemia. What is the normal WBC differential lymphocyte percentage in the adult population? Answer is 20 to 44%, because this is the normal range of WBC. So we will be continuing the next section. Kindly subscribe my channel so I could put more videos of MCQs for you guys to learn. Thank you so much.